Hi everyone. So, is any one of you concerned about that red swelling seen at the back of your child's mouth? And if unfortunately yes, then please don't be. Because this swelling that you see at the back of your child's mouth, it's a very common scenario and it has a name that's called as eruption hematoma. So, it's basically a bluish purplish kind of a elevated area. It's a swelling and it usually develops few weeks before the eruption of either the second primary molar, that is your second milk tooth, or I should say the last milk tooth that appears, or the first permanent molar. Now, as already told, so it usually appears at the place of the second primary molar before the eruption of the second primary molar. As you can see in this photograph also, it's the upper arch and it's shown at the place of the second primary molar that is about to erupt. So you can see it's quite bluish and almost purple in color, but it can occur anywhere. It can also be occurring at the place of the eruption of your incisors, that means your front teeth. So basically, it can occur anywhere, but usually it occurs here. Now, the next question that must be popping in your heads might be that why does it occur? So, it usually occurs because the soft tissue or the gum of that area, in a layman language, if I say, so the soft tissue in that area where the tooth is about to erupt, it becomes soft. And if that soft tissue is being traumatized by chewing or while having any kind of oral function, that's mostly chewing food. So when that soft tissue is continuously stamped by the chewing motion, it causes trauma to it and it turns red. Basically, the name hematoma is derived by that word because blood is entrapped in it. And that is why it seems to be red also in certain cases. And because it is seen through the soft tissue, it appears bluish also. So, yes, that is why it occurs. And now, if we come to the treatment part, so usually this is self limiting. That means once the tooth pierces that soft tissue, um, obviously the gum or the soft tissue that was previously covering that unerupted tooth now is dissolved, and that is why the tooth was able to erupt in your mouth. And once that soft tissue is removed, obviously by the eruption of the tooth, there's no more trauma happening and it limits itself. It stops hurting, that hematoma goes away. But in certain cases, the tooth is not able to erupt or it is hindering in some or the other way the eruption of the tooth. Then, in that case, a very, very, very small surgery is done. Usually takes not more than 5 to 10 minutes. What we do is we just uncover, or I should say, under the effect of anesthesia, of course, we remove that soft tissue or that small part of the gum to facilitate the eruption of the tooth. And it usually takes almost 3 to 4 days to heal. And yes, you're good to go. That's it. So that's it. This was a small topic that is very commonly seen, but parents are quite anxious about it and they have thoughts like maybe it's a tumor, God forbid, or something. So I thought this will help parents out. For now, thank you.